What are the worst exercises that you can do for sciatica? There are so many different exercises out there on the internet that it can be absolutely overwhelming. And if you're dealing with sciatica, how do you know which ones you should do and which ones you shouldn't do? Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain the 5 absolute worst exercises for sciatica and different exercises that you can do so that you can actually help relieve your sciatica symptoms. Now, if you find this video helpful, give it a like and subscribe to our channel. We help people to stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. Now, one thing you should know before we discuss the 5 worst exercises for sciatica is that sciatica isn't really a diagnosis. It's not just one thing. And so the proper treatment for it really depends to some extent on the cause of it. But there are 5 really common exercises that people do for sciatica, and I'll explain why they're bad and what versions you can do instead to help relieve your sciatica. So the number one exercise that I see people doing that they think they're doing good for sciatica, and it's actually probably causing more harm than good, is stretching their hamstrings. People often think that tight hamstrings are a major cause of back pain, and for some people they are in very rare cases, but for most people, tight hamstrings aren't a huge contributor to back pain. And furthermore, your sciatic nerve runs through your hamstring. And so you'd think that if something is tight and hurts that you should stretch it. Well, a lot of times the reason that people have what feels like a tight hamstring is actually because the nerve is irritated and it hurts when they stretch it. Now, if something hurts when you stretch it and it's irritated and sore already, then stretching it further and continuing to overstretch that sciatic nerve, which runs from your back down through your hip and all the way down your leg, is just going to get it more angry. Now, furthermore, muscles were made to stretch, but nerves aren't. That when you overstretch a nerve, it can actually cause some damage to the nerve, and nerves don't heal quickly. So you do want to get your sciatic nerve moving a little bit better, but you don't want to overstretch it. So one alternative to stretching your hamstrings is just to do a sciatic nerve glide. And you do that by sitting in a chair, and you'll straighten your leg out, but not all the way to the extent that it's bothering you. So if it hurts to go all the way out there, then you just move it through the range that you can comfortably. Nerves need 3 things to be healthy. They can't be pinched or compressed, so they need space, they need movement, and they need blood flow. And when you get movement of your muscles and of your nerve, then you get blood flow to that nerve, and it brings oxygen and helps the nerve to heal. So instead of statically stretching your hamstring in an end range position, you just want to move back and forth through the range of hamstring stretching that it feels comfortable. This should be an active stretch, not a static, prolonged hold at end range. So that's the first stretch that you should avoid if you do have sciatica. The second stretch is foam rolling. And a lot of people think that when something hurts, you should foam roll it. And that, again, for many of the same reasons, is not good for your sciatic nerve. That if the nerve is already inflamed and sore and you roll on it with a foam roller, then it's just going to make it more inflamed and sore. So instead of sitting on the ground and rolling your hamstrings on a foam roller, again, this is one of the things that you don't want to do if you have sciatica, particularly not rolling on the sore side. You might try doing it on the opposite side instead, but even more important, many people with sciatica have tight hip flexors, which then throws their back into extension and pinches on the nerve roots where the sciatic nerve comes out. So it's often more beneficial to actually roll on your quads and your hip flexors, rolling on the things that actually aren't sore but are contributing to the problem. So instead of just treating the symptom, you want to treat the things that are actually contributing to the symptom. So treating the cause of it, so to speak. Now, the next exercise that I commonly see people do for sciatica that is sometimes good, but sometimes bad, is a piriformis stretch. And the sciatic nerve, it runs underneath your piriformis, but in a small percentage of people, it actually pokes through the piriformis. And there's something called piriformis syndrome, where the sciatic nerve is being compressed underneath your piriformis. Now, that can happen if your piriformis is spasmed and tight around that sciatic nerve, particularly if it's piercing through the piriformis. But if it's underneath and it's spasmed and tight and you go to stretch it, you just pull it even tighter. Now, in a lot of people who have sciatica, the piriformis isn't even tight. A lot of times it's weak, and when they walk, their muscles in their hip get overstretched, and that causes compression on the nerve. But by stretching it, you actually make the muscle longer and you overstretch it even more. So in order to get rid of your sciatica, you want to first test if you actually need to stretch your piriformis. So to do that, you can cross one leg over and just let it drop down to the side like this. And then check the other side and do the same thing there. And the normal is to be able to get your leg down to close to 90 degrees there. So if you can get it down to almost parallel with the floor, then that's pretty normal. If you can do that very easily, you don't need to stretch your piriformis. Even if it feels like you're feeling the burn back there, that's actually probably not a good thing. Now, if your motion is limited, but you don't feel any pain or you don't get any symptoms of sciatica, that's a case where this piriformis stretch might actually be good for you. So the thing that you should not do, one of the worst stretches for sciatica, is painful piriformis stretching where you're pushing as hard as you possibly can. Just go to the point that it's limited. And if it's the other side that's actually more limited than the painful side, stretch the other side instead of the painful one. Again, we're looking for stretching out stiffness in muscles, not stretching symptoms to the point where you're feeling the burn and you feel like you've got that good pain, which in this case may not actually be good pain. So that's the third exercise. The fourth exercise is using a tennis ball underneath your sciatic nerve. And again, your sciatic nerve runs through your buttock, underneath the piriformis, or in some people through the piriformis. So if you're sitting on a tennis ball and the nerve is irritated right here in your buttock, you go and push pressure on it, again, you're just mashing down on something that's already sore and painful. And that doesn't really help the problem. Now, in many people, like I said, the sciatic nerve, the piriformis is actually stiffer on the non-painful side than it is on the painful side. So instead, try using that tennis ball under the other hip and roll on that other hip instead of on the painful hip. So that's the fourth exercise that you should avoid if you do have sciatica, and an alternative for it. Now, the fifth exercise is actually something for sciatica that comes from the back. And again, most sciatica does come from a back problem rather than in the buttock or in the hip, even if you don't have any back pain. The nerve roots, until they're ruled out, are still my number one differential when I see a patient with sciatica in the office. I assume it's the back until I can rule that out. So one thing that people have historically thought is good for bulging discs or herniated discs, and this comes from many, many years ago, a guy named Robin McKenzie developed this Treat Your Own Back book, and they were largely extension exercises. And those are good for some people. It's usually younger people who have had a herniated disc and have symptoms that go down their leg, but what they've found over time is that doing press-up exercises where you press all the way to end range doesn't centralize the disc. It actually sometimes extrudes the disc out or makes it bulge or herniate out even farther. So you don't want to do press-ups to end range. And what I mean by that is where you lay on the floor and you come up into a cobra type pose like this. So you don't want to go into this big arching cobra movement. Even though it's a common yoga stretch, if you had sciatica, this is probably a position that you want to avoid especially if you're over the age of 40, because your spine loses this extension type of motion as you age anyway. So instead, it really depends on this, what your symptoms are aggravated by. If your symptoms are more aggravated when you're sitting in the car or when you're doing bending type activities, then you may want to do a little bit of extension activity. But something more gentle, like just doing a standing extension like this, where you're leaning back a little bit, trying to get a smooth extension, a C curve through all your lumbar vertebrae, instead of hinging at that lowest one, the L5, S1, or the L4, L5, where a lot of sciatica symptoms do come from. Another alternative, if you have trouble weight bearing and just standing up doing backward bending is painful for you, you can also do a modified press up where you're just trying to roll up and you're not going all the way down through the back. You're just going through a partial range of that, not getting that sharp extension down at the lowest part of your back, but just getting a partial extension and kind of more of a C curve, not hinging at any one segment. Now that's for sciatica that feels worse when you're sitting or have your back in a rounded position. As you start to age, you may develop degenerative discs or even spinal stenosis or things like that. Sciatica symptoms can be caused by the opposite problem though. You start to lose this extension tolerance and going the other way, going into forward bending or flexion may be better for you. So instead you can do a child's pose where you're stretching back like this, and this opens up the spaces in the lower back where the nerves come out. Or if you can't get down on the floor comfortably, you can also do that same thing sitting in a chair. So where you bend forwards like this and flatten out your lower back. So those were the 5 worst exercises to do for sciatica. And just to summarize that was stretching your hamstrings, foam rolling your hamstrings, overstretching your piriformis to the point of pain, using a tennis ball under a painful piriformis. And the last one was doing extreme backward bending cobra stretches. Now, ultimately, you do want to find out what's causing your sciatica in the first place. Because like I mentioned at the very beginning of this video, that sciatica isn't a diagnosis. It doesn't point to one thing. It doesn't point to a treatable problem. It's merely a symptom that means pain in the back of your leg. And so you need to, number 1, find out what's causing it, and number 2, do the appropriate treatments to help treat that cause. So I would recommend, if you are dealing with sciatica, it is something you should probably reach out to a healthcare professional about. If you happen to be in St. Louis, you can contact us here at More for Life and we'd be happy to help you. And no matter where you're watching this from, if you found this video helpful, give it a like, subscribe to our channel, and share it with other people who you think may benefit from it. Thanks for watching and have a great day.